CRIS stands for Clinical Record Interactive Search, and it was something we developed over 15 years ago at the South London and Maudsley. And essentially, it very simply allows us to learn from health records. The South London and Maudsley has had fully electronic health records since around 2006. This creates an enormous amount of information that's accrued over the years, and we're trying to learn from that information. The most important thing is being able to use the information securely so that it's completely anonymous. I would expect my healthcare information, when it's used, to be used anonymously, and the same for anyone else. CRIS is particularly well suited to investigating what happens to people when they have a mental health problem, how it evolves over time, looking at much longer term outcomes than any conventional research study could. We've had an enormous amount of impact with CRIS, from children to older adults with dementia, in all different settings and all different disorders.
So she's trying to see whether it differs, whether they were that.
Particular achievements that come to mind are around how we've managed to advance knowledge on physical health inequalities and really influence the way governments now think about physical health in people with mental health conditions. We were also able to use it, importantly, in the COVID pandemic more recently.
We did some work really mapping out deaths actually in service users during the early stages of the pandemic, and we were able to show that there was a hugely elevated risk of death across a number of different types of conditions.
And that knowledge directly led to prioritisation for vaccination for people with mental health conditions, which I don't think would have happened otherwise.
I think in many ways the work that we're doing with CRIS is already translating into positive impact for patients. And you see that in some of the interactions that we have with patients in advisory group work that we do with them.
I'm a carer for somebody who was diagnosed with schizophrenia, and it turned out she's now been diagnosed as paranoid schizophrenia. Well, we meet quarterly, probably 12 of us maybe at times, to make sure that the data and the people's not identifiable, and that the presentation and what's told us is down to earth, really, understandable. You know, it helps to know that the treatment is getting better through research.
So much of the important information that we have on people's experiences is recorded in text rather than in, say, a tick box or a structured field, as we call it, on the computer. And that will always be the way. And over 10 years, we've built up an enormous amount of capability to use information from text in order to advance research.
So in over 2,000 patients, I developed a tool to look at recorded cannabis use in the electronic health record, and demonstrated that not only was recorded cannabis use associated with increased rates of hospitalization, but there's also some evidence that it may have an association with poor response to antipsychotic treatment, and of course that has implications on planning treatments and developing new treatments for people who are experiencing psychotic disorders and who may be using cannabis.
So one of the reasons for the success of CRIS and how it's become world leading is very much about the skill sets that we've built up in the team that support CRIS work, because I don't think we'd be able to do it without those people and without those skill sets. Very often pushing forward new ideas, and I don't think that we'd be where we are without the huge numbers of people that support the system.